Cortisol, affectionately known to most of us as the stress hormone, has many important effects and functions throughout our body. Being overwhelmed, it seems like an everyday occurrence to most of us, right? But does it have to be? Hi, I'm Katie Jobbins, co-chair for Wellness and the Associate Program Director for the Internal Medicine Residency Program at UMass Chan-Baystate. Today in this 3 in 3, I'll be talking about feelings of being overwhelmed and strategies to help us mitigate our stress responses. It's important to remember there are different types of stress responses. There is acute stress, like running away from a grizzly bear, or chronic stress, when we are faced with difficult or frustrating jobs or even chronic illnesses. And lastly, there's traumatic stress, when you've experienced, seen, or cared for a patient in a life-threatening event, which often leaves us feeling helpless. At its simplest explanation, cortisol helps promote our survival and mitigate our stress, like running away from that grizzly bear. However, prolonged stress responses lead to downstream effects like cortisol dysfunction. Today, we will briefly review what feeling overwhelmed can look like, how to reframe it and make it beneficial, and lastly, discuss a few simple strategies to decrease our stress hormones. The face of healthcare changed as we know it in 2020. So did the level of our workload. As clinicians, we were working more hours, caring for sicker patients, being asked to do more both at work and at home with less overall resources. This has ultimately led to intensification of our feelings and increased occurrence of big emotions. Overwhelm being one of them. And often it's multiple small events that build up over time, and it leads to a much bigger reaction. These can come across as tears, anger, resentment, or even everything in between. So what are the steps we can do today to take feelings of overwhelm and reframe them? First, name it and share it. There is no shame in sharing how you feel. Most often, it's the right way for us to connect. Research shows that sharing our lives, be it our struggles and our wins, actually improves our connection, fulfillment, and joy. And if we share our small wins and our big struggles, it normalizes this. Second, be purposeful in how you release your cortisol. If you feel like your overwhelm is at an all-time high, there are techniques that you can do to help lower it. For example, a mindful body scan. Close your eyes, feel your body, see where your stress is at. Second, clenching all the body muscles, then release them after 10 seconds. These techniques give your body permission to acknowledge that the perceived threat from our fight or flight response is over, and it can now lower the stress response cycle and break it. The last thing I want to discuss today is a grounding technique, which are very useful when you're in your workspace. This allows for you to get out of your head and back into your body. Here's a simple one that I use that takes about 2 minutes. You start by placing your hands on either your desk, your legs, or whatever is near you. You then close your eyes and take some nice, slow, deep breaths. You then focus your thoughts directly where you can feel in your hands. Is the surface warm or cold, hard or soft, textured or smooth? And you continue to breathe and focus on your hands. This allows for you to essentially ground yourself thoughtfully, slowing down your breathing and your thoughts. If these techniques are something you want to learn more about, there's many resources here at Baystate. Don't forget to check out the Baystate Healthy site for additional well-being resources, one of our tranquility rooms that are around the health system, and consider joining our Provider Wellness Council. Thank you so much.